Ganesh B. Raman for his talk on light trials and its clinical relevance. Sir is the head of glaucoma services, Aravind High Hospital, Coimbatore.
Thank you, Dr. Smith and Dr. Girija, and I'd like to thank the Scientific Committee KSOS for this opportunity. I also like to thank Dr. Indra Pegu, some of these slides of which she sent to me and I'm sharing with you. So I'll speak into your light trials and its clinical relevance today. So this is the first article by the So light trial is a multi-central trial which was was done between 2012 and 2014 in the UK, and it's 6 hospitals were involved in it. And then these are the publications which have come out 2019, and 2023 is the 6-year data, and also the 2016 was the initial primary selective trabeculostomy for open angle glaucoma, clinical predictors of success and safety. And then you also have the 6 years data, which was published recently. And if you look at this chart, you see that IOP at 2 months in the primary patients group, patients who had an increased intraocular pressure presentation had a very good outcome at the end of 2 months after the SLT. And this is the SLT group patients. And this sort of, in that time, it sort of motivated me to look into SLT also, as the trials were being published. And as I mentioned, it's a multi-center randomized control trial. And it also, apart from assessing the intraocular pressure control, it looked into the health-related quality of life. And treatment was mainly addressed to the open angle and the ocular hypertension group patients. And the outcome was tested at 3 years. And prospective, and these are the parameters which they measured at for the health-related quality of life issues. And they had multiple questionnaires which were addressed on a series of patients and during the whole period of study, and then outcomes were reported. So in all, there were 718 patients were randomized, 356 patients in the SLT and 362 in the drops group. So this was a laser first to medication first trial. And the end of the study, 263 patients were analyzed, and 261 patients were analyzed in the SLT as well as the medication group. So after the initial 3 years, they had an extension group. So treatment naive patients and having open angle glaucoma and ocular hypertension, when they treated with SLT and AGM, the outcome measures at 6 years were reported. And after initial 3 years, patients in the SLT arm were permitted a third SLT. So initially they were given 1 or 2 SLTs, and then they were given the third SLT after 3 years. And patients in the medication arm were allowed to undergo the SLT also. So of the 692 patients, 633 patients entered the extension phase, and 82% of the patients completed the extension, that is 6 years. There was no difference in the quality of life symptom scale, and the glaucoma symptom scale was slightly better for the SLT than the AGM group. 94% of the patients in the initial SLT group achieved target IOP. That's at 6 years, and target IOP was achieved in 92.8% of visits in SLT group. In the medication group, 94.7% of eyes and 93.2% of visits achieved target IOP. So drop-free control was achieved at 72 months in 69% of patients in the initial SLT, 90% of them who had received 2 SLTs, and only 18% in the glaucoma medication group, mainly because they were switched to SLT, they had undergone cataract surgery. And some patients have also undergone cataract, SLT followed by cataract surgery. And 19.6% of eyes demonstrated, who had SLT demonstrated a progression from OHT to OAG and deterioration of OAG as compared to 26.8% of the AGM group. So the caveat here is that patients who were initially advanced and were offered SLT, they are the ones who sort of progressed into the progression group. And if you look at the SLT group who required TRAB, 13 eyes in the SLT group versus 32 eyes in the anti-glaucoma medication group required TRAB at 72 months. And in the SLT group, at the end of 3 years, none of the patients had required TRAB, whereas 11 eyes in the first 3 years required TRAB. And also phacoemulsification was done more in the glaucoma medication group compared to the SLT group. And this is also this image tells you the the time to disease progression. So in the drops arm, the progression occurs faster as compared to the SLT group. So at the end of the 72 months, you would see that the intraocular pressure is slightly higher in the SLT group compared to the drops group. But comparing the interventions which are done, they are far less in the SLT group. So we have been doing SLT since 2014 onwards, and we have a small data of 1 year. At the 2015, we had collected data for patients who had undergone SLT in 2015 for 1 year follow-up. And if you see the intraocular baseline characteristics, you look at we had 103 OHTIs and 36 POAGIs. And the intraocular pressure was 22 in the OHT group and 22 in the POAG group. They were all treated patients. They were on treatment, but once we did the SLT, the intraocular pressure fell from 22 to 17.4 in the total group. In the PAGIs, it was 22 to 16, and OHT was 22 to 17. And the number of anti-glaucoma medications drastically reduced from 0.6 in the OHT to 0.02 and 1.22 in the POAG to 0.09. The only condition which we had was we did not take patients who had visual field defects in this group. So we were very careful to include patients who had no visual field defects. And this is how we also advise SLT or patients. We avoid offering it to patients who have visual field defects. So it's almost pre-perimetric glaucoma in which we treat. And if you take the treatment naive eyes, there are very few in number, less than 10. But at the end of 1 year, you'll be very surprised that out of 20, the intraocular pressure of 22 on treatment comes to 14 at the end of at the end of 1 year. So you can get quite drastic intraocular pressure drop if you were to do SLT in eyes which have not been treated at all. And the only factor which we found was the raised intraocular pressure presentation, which is the important factor which determines the success of the procedure. And we also did a small pilot study, 21 eyes of 30 patients. We did a diurnal intraocular pressure after SLT 6 months out. And then we found that it wasn't fluctuating so much. There was 17, I don't know why the graph is upside down, but 17.505 to 16.87, that was a range at different times of the day for the 21 patients. And now we have the recent device, which is from the Zeiss, no financial interest here. And we have, I'll just present you the 3-month data, which is out. So the baseline IOP in which patients we included was 24, and mean deviation minus 5.75. And all the patients are phakic, so we did not include any patient who was pseudophakic. And the mean intraocular pressure dropped from 24 to 20. So we had 18% IOP reduction. Because this is a real world, we are offering patients as they walk into the clinic. 5 patients were still back on 1 medication, 1 patient on 2 medication. 1 patient underwent cataract surgery immediately 20 days after SLT. So that patient we were planning to, he had a mean visual field index of 30%. We wanted to avoid a surgery, trap surgery, so we offered SLT and then offered him cataract surgery. So we find that SLT does work, and since this real world data, I think we'll have a 1 year data will tell us how to manage these patients. So the other paradoxical thing is, from India, we don't have any data on OAG or OHT. The only 2 published trials are on young patients and on angle closure. So I think we should look into SLT, and maybe by the end of the year, we'll have some data to share with you. Thank you very much.
Thank you, sir, for that wonderful presentation. Actually, the Indian studies are what we need, because how these lasers act on Indian eyes, we need to know. All the other studies are being done on other ethnic groups, so let's hope that it gives us good results.